Hey everyone, welcome back to MedEquina, where we dive deep into fascinating topics. Today, we are going to explore a comparison between Parkinson's disease and Alzheimer's disease. These are two distinct neurodegenerative disorders that often get confused due to some overlapping symptoms. So, let's break down the differences and similarities across various aspects. Epidemiology. Let's start with the numbers. Parkinson's disease and Alzheimer's disease are both prevalent, but they affect different age groups. Parkinson's usually strikes people around 60, while Alzheimer's tends to manifest later in life, typically after 65. Alzheimer's is more common, affecting about 5.8 million Americans, whereas Parkinson's has around 1 million cases in the US. Risk factors. Now, what makes someone susceptible to these conditions? Genetics play a role in both diseases, but Alzheimer's has a stronger genetic link. Age is the biggest risk factor for Alzheimer's, while Parkinson's risk increases with age but is also associated with family history and environmental factors like exposure to certain toxins. Pathophysiology. Moving on to the nitty-gritty of what's happening inside the brain. Parkinson's is characterized by the loss of dopamine-producing neurons, leading to motor symptoms. Alzheimer's involves the accumulation of beta-amyloid plaques and tau tangles, causing widespread neuronal death and cognitive decline. Signs. How do these diseases manifest? Parkinson's often shows itself through tremors, rigidity, and bradykinesia, slowness of movement. In contrast, early signs of Alzheimer's include memory loss, confusion, and difficulty performing familiar tasks. Symptoms. As these diseases progress, the symptoms become more pronounced. Parkinson's patients may experience balance issues and difficulty with coordination, while Alzheimer's patients may struggle with language, judgment, and personality changes. Diagnosis. Getting an accurate diagnosis is crucial. Neurologists use a combination of clinical history, physical exams, and imaging studies to diagnose Parkinson's. Alzheimer's diagnosis often involves cognitive tests, brain imaging, and sometimes spinal taps to analyze cerebrospinal fluid. Prevention. Can these diseases be prevented? While there's no surefire way to prevent either, maintaining a healthy lifestyle, staying mentally active, and engaging in regular exercise may help reduce the risk. Prognosis. What about the outlook? Parkinson's tends to progress more slowly, and with proper treatment, individuals can lead fulfilling lives for many years. Unfortunately, Alzheimer's has a more gradual and irreversible decline, leading to severe impairment over time. Treatment. Lastly, let's talk about treatment. Parkinson's is often managed with medications that boost dopamine levels or deep brain stimulation. Alzheimer's has fewer treatment options, focusing on medications to manage symptoms and lifestyle interventions. While Parkinson's and Alzheimer's share some similarities, they are distinct in their epidemiology, risk factors, pathophysiology, signs, symptoms, diagnosis, prevention, prognosis, and treatment. Understanding these differences is crucial for accurate diagnosis and appropriate care. If you found this video informative, don't forget to like and subscribe for more in-depth explorations of fascinating topics. Until next time, stay curious.